Hi, this lecture is about syncope and orthostatic hypotension. So what is syncope? Syncope is fainting. This unfortunately is very common in the dental office. What is it? It's a decreased blood flow to the brain, and this can be caused simply by laying flat when they recline the dental chair for a long period of time, or by sitting upright, very straight upright for a long period of time. It can also be caused by emotional or physical stress. The emotional stress is common. What are the signs of presyncope, or right before a patient faints? They might be pale. You will actually see the coloring go right out of their face. They might have a cold sweat, dizziness, nauseous, a warm feeling. Signs of syncope when they actually faint: they might have a death-like appearance, that they'll just go out, shallow breathing, dilated pupils, sometimes, not always, but they might have a convulsion type of movement is possible, and their vital signs are low. Some of the causes: so the psychological stress, especially for patients under the age of 40, is fear, pain, anxiety, and the sight of the needle. Some of the physical is hunger, poor health, remaining upright for a long period of time, and exhaustion. The conscious patient. So the patient is right before they will faint and they're still conscious, but that you start seeing the coloring going out of their face, and they give you these other symptoms. Oh, I feel dizzy. You're going to place the patient in Trendelenburg position, and we're going to talk about just what that position is in the next slide or two. You might loosen their clothing or jewelry. If a patient is pregnant, however, you don't want to put them in this Trendelenburg position, which is straight back. You're going to put the patient on their side and then elevate their feet. You're going to monitor their vital signs and remember to quickly inform the doctor of any problems. For the unconscious patient, the person now has fainted, you're going to place them in the Trendelenburg position, loosen the clothing. So just as before, you might place a cold compress on their forehead. And you can also do that for the person who feels like they're going to faint. They haven't gone out yet. You might administer that smelling salt that we talked about that's in the medical kit. You monitor their vital signs and administer oxygen. So what is Trendelenburg? Supine position. So here you have the patient in the dental chair, and if you kind of look at this, their feet are higher than the head. So you're going to lay the patient all the way back, all the way back. Now you can see this would not be a good position if the patient was pregnant. So before you lay them down like this, you help the patient roll to one side and then do it. The main thing is you want to get those feet elevated. Syncope: if the patient is not in the dental chair and goes into syncope, then you want to lower them to the floor and then raise their feet. What you're trying to do is get that blood back to their brain, back to, so it can circulate. Administer oxygen and follow the same protocol. So you're going to continue emergency care right after this. You just want to keep the patient calm. And if they do faint or they saw the side of the needle, you want to make sure that needle has disappeared from when the patient comes back. Or sometimes the site of blood, you're extracting a tooth. Clean up that area or cover that area so when the patient doesn't recover and sees it again and then faints again. You then give the patient time to recover and keep them calm and quiet. They're just nervous. Postural hypertension. So this is a positioning. So when the patient has laid down for a long time there, and you brought them up too fast, this is why they may go into a syncope here. So when you want to bring that chair up slowly after they've been down there for a while. Causes of it: so maybe administration or injection of drugs, pregnancy, varicose veins, hypertension, physical exhaustion, starvation in the age. So if the patient does have syncope, you want to note it in the chart. And chances are, if this patient fainted once because they were nervous, they're going to faint again. So put a note there. Thank you.